Welcome to the DiepCJourney Foundation educational channel. I'm your host, Terry Kuti, and the founder of DiepCFoundation.org. This platform is one of the resources we provide at DiepC Foundation, but we also have the DiepCJourney podcast, and you can find that on Spotify, Amazon Music, and Apple Podcast. So why am I bringing that up today? Well, I'm sharing it with you because my guest and I promised a return interview follow-up on a recent DiepCJourney podcast titled Rori Zura of Foobs and Fitness, Exercise and Breast Cancer. I invite you to check it out over on Spotify and all of the platforms I listed earlier. So she's back as promised with some exercise tips and a really great presentation today. Rori, how you doing?
I'm good. Enjoying the last couple of days that we've had of this year-long month, but
Year-long month. Yes, we are recording in January. I think that they should stay tuned for a little fun over on your Instagram account in February.
Yep.
Yeah, dangling another little carrot with Rori. Um, do you want to set up this presentation for us this morning? Because I love the tips that you share. And also, you've got some research back information about your work. So
Mhm.
I'm going to sit back and let you get it set up and drive for us this morning. All right, let's get going on this presentation. I see it. I'll let you get started.
Okay. Well, I am so thrilled that everyone is here and watching, and I appreciate the invite to return back on this amazing journey with you all. My name is Rori. I am the founder of Foobs and Fitness. This session is all going to be concerning movement as a part of medicine, particularly for breast cancer survivors. This is probably one of my favorite things to tell any individual, whether you're trying to prevent cancer, recovering from cancer, even if you're a caregiver helping someone that you love fight against cancer. Getting regular physical activity is undeniably one of the most important things that you can do for your health. I like to think of that as like investing in a 401k, right? Your ROI on movement is going to benefit you multiple times down the road. So when you're 60, 70, 80, you see these frail individuals, that potentially may not be you as long as you're getting regular physical activity. So what are we going to be covering today? The big question that I get asked is why staying active matters after breast cancer. Some of the common challenges that you may face and how to overcome them. We'll also do some gentle stretching, sessions together that we're getting up and moving. Don't worry, you can do this right in your own home. There's no special items that you need to have for this session. I'll also be answering some questions that may come up from this presentation. So let's get started.
And I want to remind those that are watching to put your questions in the YouTube video because I will keep an eye on those. If I can't answer them, I will reach out to Rori.
And I will be very happy to answer them.
Thank you.
So let's do some background information before we dive in. So I'd like to share a little bit about my story and let you guys know why I'm so passionate about the work that I do. I started finding lumps in my 20s. I had a really dense history of cancer, especially breast in my family. I tried to get it a preventative mastectomy, but my insurance at the time denied my case for not meeting the criteria that they had at the time. So I let the dice roll. I lost my job due to COVID. And then only a few short weeks later did I develop a lump in my breast that for the first time in my life did not go away when my period came and went. This prompted lots of scans, mammograms, ultrasounds, 3D mammograms, and eventually a biopsy, which confirmed that I had a more aggressive type of breast cancer called triple negative breast cancer. Throughout my treatment, I worked out. I didn't really have to battle those quintessential chemo side effects. I lifted heavier than I had ever done prior to being in treatment for breast cancer. And when I asked my oncologist about how this could be, he was met with this exercise can actually reduce treatment side effects and actually lowers the risk of reoccurrence. So I promised myself that after I went in for my double mastectomy, which was very, very much waited for, I would go back to school, get my certifications, become a personal trainer, and help fellow breast cancer survivors take back control of their lives. I like to tell everyone that you are the CEO of your body. It's a reminder that you have all of the power to make the decisions, to set boundaries for yourself, and really take control over your health. That's why I believe in everything that I do. It is in the heart of what I have created for Foobs and Fitness to help other survivors, caregivers, previvors regain their movement, their strength, and their confidence and find happiness in their life after cancer. Another quote that I am constantly telling all of my clients is movement is progress, not perfection. Our bodies are so resilient, and going through a cancer diagnosis, preventative mastectomy, whatever it may be, your body is absolutely resilient, and that is a testament to it. When we're going to recover from things like this, we want progress. We're not going to get perfection right off of the bat. We need to work up to that. Progress is also not linear. So kind of taking 2 steps back to take 4 steps forward is normal. And I want people to understand that you want to go slow and steady. You don't want to be rushing through things like a marathon, because it's a marathon. It's not a sprint, right? The slower you go, the more impactful it has on your habits, your body, and your lifestyle. And that's why they say exercise is a lifestyle, not a trend.
And Rory, I'm going to add another P word to that last slide, patience. We have to
Patience.
have patience with ourselves. I love that quote, though.
It is undeniably my favorite thing to say to people. I know it gets frustrating, and your body will not match your mind for quite some time. You get this feeling of after cancer treatment and surgeries, like I'm done, I'm ready, like I'm so excited to get back to my normal life. And then you go and do normal life things and you're like, what the hell happened, right? That is normal. It's going to
Yeah.
take a while for things to match up, but that's okay.
Yeah.
So let's talk about why staying active matters so much, right? Let's put the pudding where our mouth is, right? So here's some studies that I have based a lot of my training off of. Exercise actually reduces fatigue and pain. Studies have shown that when someone has regular exercise, their fatigue can be reduced up to 30%. I want to repeat that. If you have regular activity, your fatigue can be reduced up to 30%. That's huge, especially when you're in that mental state where you're like, I can't do anything. It is so overwhelmingly tired. The more you move, the less tired you will feel. I know that sounds like a little bit of a hamster wheel, but a body at rest tends to stay at rest. And that's not saying that you have to go run miles or go to the gym. Light, gentle movement, stretching, resistance training, throwing those all in together, little sprinkles here and there throughout the day, is a great way to get that 30% reduction.
Yeah, our bodies are machines meant to move. And I always go back to one of my favorite quotes from my centurion grandmother, who has passed, but she always said, I'd rather wear out than rust out.
Yes. Oh, I love that.
Isn't that awesome? I
Oh, I'm going
love,
to steal that.
I love that quote from my sweet grandma.
Oh, she is very, very, very wise, that one.
Yes, yes.
So another component that we had kind of touched in on, right, is that stretching and the resistance training.
Mhm.
And that's where the bread and butter basically of Foobs and Fitness is lengthening and strengthening, right? And studies have shown to improve upper body mobility by another 30%. So you're standing there after a double mastectomy, let's say, and you're barely able to get your arm over your head. By stretching and engaging in resistance training, you're working towards a 30% increase of mobility. So that's getting up a little bit higher, right? That's maybe being able to do your hair after having a double mastectomy rather than having someone help you wash your hair and things like that, right? One of my favorite exercises is being able to do laps around the house, right? Loved that during treatment, loved that after my double mastectomy. And it boosted my mood, my energy, and my confidence because I wasn't just, rusting out like your grandmother said. I was moving, I'm lubricating, I'm doing things to keep that mind active. And physical activity has been shown to decrease anxiety and depression by up to 20% in breast cancer survivors. Exercise is that release of that feel good hormones, the endorphins, right?
Mm-hmm.
There's maybe some people who are listening to this that know of a runner's high. It's the same sort of thing. Fresh oxygen comes into our body. Our endorphins are released because we get that hit of that oxygen after being so stagnant. And it's just a nice increase in being that feel good, right? But it's not just about feeling better emotionally, right? It's about combating side effects that we go through during treatment. So for example, say we have gone through chemotherapy, double mastectomy, and then we've had to go through maybe some radiation as well, right? Our lymph nodes take a huge beating in that. And a big thing that I combat myself is lymphedema.
Mm-hmm.
And gentle movement and exercise actually improves your lymphatic flow, which can help inadvertently help with lymphedema. So active survivors gain about 25% less weight compared to inactive survivors. So again, that's that benefit. Maybe during chemotherapy you couldn't move all that much, right? It takes a toll on us, and you do what you can when you can. You give your body grace. But maybe you've gained a little weight because you're on steroids or just the new hormones that are not in your body anymore. All of those things are normal. 25% of those people who experience that actually start losing weight with more physical activity, which can improve your overall health.
Mm-hmm.
We all know that staying active lowers, comorbidities like heart disease and things like that. But going back to what my oncologist said about how exercise reduces the risk of reoccurrence, right? That's a really big push for us to get more active, right? I don't want to go through this again. I've already gone through it once. Maybe I've had to go through it twice. I don't want to keep going through this. So staying active has actually been shown to lower your risk of reoccurrence by 30 to 40%. That's a big, big number. And that alone makes movement one of the most powerful tools that we have for thriving after cancer.
Yeah, and Roy, there's another term that I use. There's no guarantees, right?
Yep.
When with breast cancer, we can't use the word guarantee. But what I call these items that you're talking about are stackable items.
Yep.
Exercise, movement, healthy diet. Those are all stackable items. Why not stack them up and invest in your health? The other thing, too, that I think about, which makes so much sense to me, is the fact when you get up and move, when you physically get your body up, or even sitting in a chair and you start small movements, it is a distraction. It is
Yep.
a distraction from thinking about a diagnosis. That's the way I often think of it. And so throwing my little piece in there too. So
I absolutely agree with that, right? Going back to those laps around the house that I used to do, right?
yeah.
I would make it a game. And I'd sit and watch TV, and during the commercials, I'd get up, and I have two French bulldogs who were my through and through, my little gang during treatment. And I would get up, and we would all go through each of the rooms in my house, and they would play, "Where's mommy going? Where's mommy going?" And it was a game, who could get back to the couch first, right? And usually my male dog would beat me to it, but it became a game. And that's something that I tell people with kids, right? They want you to feel better. Your family wants you to feel better. They're constantly asking, "What can I do to help? What can I do to this?" Use them. Go for a walk in the backyard with them. If it's nice out, if it's 30 degrees or below, maybe, stay in the house, but go outside. Go take a lap around the perimeter of the house and see if you can play hide and seek with your kid or something, and just maybe let them seek you a bit more often. But these things that can act as a distraction, get you moving, and then it also makes your caregivers feel like they're doing something. So you don't
Part of
have
it.
that constant, "Oh, well, if you need me, let me know." Well, I don't want to have to tell you what I want. So it's a nice load off of everybody's shoulders.
I love that. I love that. And I love the fresh air element.
Mhm.
Even in the chilly air. Yeah, I love that.
Yep. It's very important that we get outside. It's called grounding. We
Mhm.
want to make sure that we are connecting with nature. If you can't get outside, that is totally understandable. I just battled the Arctic freeze. So I couldn't get out there as much, but my dogs force me to go out at least for 5 minutes or so, because they have to pee.
Yeah.
And that's
Yeah.
movement.
Yeah. Or go stand by the window when the sun comes up in the morning.
Yep,
Yeah.
exactly.
Okay.
So I know that this all sounds, it sounds ideal. It sounds great. Yeah, I know I should be doing them, so on and so forth. But there's a lot of fears that come up when associating with exercise and breast cancer, and that's normal, right? And the one that I hear most often is, "I don't know where to start." And my advice is always as simple as pie. You don't have to do an hour-long exercise. You don't even have to do a 30-minute exercise. 5 minutes sprinkled throughout your day will help you get into the swing of things. So like I was saying with the commercial and the doing the laps around the house, you can switch that up. If you've just done a lap on your last commercial, stretch out during the next commercial. Or if you haven't gotten any water, maybe get up, go over to the kitchen, grab some water. All of that is movement, especially while you're going through treatment. The same goes for after a double mastectomy, right? We don't have that range of motion. Maybe you've had a lumpectomy, and the lymph nodes are all in there. Go over to the wall, do some stretches, roll out those shoulders. Anything that you can do sprinkled throughout the day will lead up to this big impact. So I always tell people the smallest movements always have the biggest impact, because the smallest movements are things that we can do more often rather than less of the big movements. So that's the caveat.
Mm.
Another fear that I get quite often, and this is what we talked about earlier, is lymphedema. What if I develop lymphedema? I have lymphedema. Can I work out? It's really painful. What do I do? This is a very valid concern. I myself have battled lymphedema, and I want everyone to understand that lymphedema is not always what it looks like on Dr. Google. It is a flare-up when caught in its earliest stages. So just like breast cancer, lymphedema is stage 0, 1, 2, 3, and 4. Okay. As long as it's caught in the early stages and worked on in those early stages, a flare-up can be reversed. Now, that's not to say that that doesn't come without its own challenges, but the lymphatic system does not have a built-in pump like the cardiovascular system. The lymphatic system relies on our muscles contracting and retracting, right? That pump to
Mhm.
move the lymph through our body. So for example, if we have lymphedema in the arm, our arm relies on the motion of bringing our hand to our shoulder or our fists back and forth to pump all that lymph up to the shoulder and then into the abdominal cavity. So research has shown that gentle, low impact exercises can actually reduce the risk of lymphedema, and it helps manage existing symptoms. I am someone who actually developed lymphedema throughout my course of treatment. I got fitted for a sleeve. I have my compression sleeve that I'm wearing when I'm working out, when I'm in a flare up. I wear it all the time when I'm flying. It's better to know about lymphedema, know its signs and its symptoms so that you can understand your risk and take action if there is something that doesn't feel right. And then there's the last classic question that I get and fears is, I just don't have the time, right? You have a busy life, you just got done with treatment, you want to get back to being normal, quote unquote. That is totally fine. But movement, again, doesn't have to be a all or none thing. I would rather you do little things every single day than one big thing here and there. So my clients,
5 minutes sprinkled
5
throughout the day.
minutes.
I wrote that down.
5 minutes. That's all you have to do. I break things up into like morning, afternoon, and PM, right? So for most of my clients, depending on where they are in their program, they'll get like a morning mobility segment. And it's something that you can do right in bed. You don't even have to get up, right? It's a nice open book stretch that you can do, wake up the body, and then go in the shower and start getting ready, right? Most of us have a really quick morning because we value that last minute of sleep before the alarm goes off. And then set an alarm on your phone at maybe lunchtime. You know, if you can't get up every hour, that's fine. Some of us kind of get lost in our work, but make sure you get up at lunchtime, go for a walk around the building. If you work from home, do those laps around the house. You know, try not to eat lunch in front of your screen because then you're not giving yourself time, right? And then I have PM stretches that I give everybody that's in my program because it helps calm the nervous system down, right? And as breast cancer survivors, we're often stuck in that fight or flight mode. Anytime that we can kind of not calm that nervous system down will help bring us out of fight or flight. So a nice gentle PM stretch where you're breathing into these stretches, 30 seconds a piece, and then you go right to bed. All of this adds up to that big component that we keep talking about, right? Those are little things that have been sprinkled throughout my day that add up to a big result at the end of things. So I know that we're on YouTube, but I want everyone to take this time and reflect. Think about the things that we have gone over so far in this segment. And if you can think of anything that you want to ask, please feel free to drop it down in the discussion. You can maybe message if you need to. We will do our best to try and answer these questions for you.
I will watch for those comments and stay on top of those, Rori.
Yay! So what do I want you all to remember from this, right? We've reflected, we've gone through the things in this presentation. And I want you to remember that first and foremost, consistency is more important than intensity, right? So that's that 5 minutes every single day versus the one big thing. You don't have to do it all at once. Start with short, manageable sessions like 5, maybe 10 minutes every day to see a big impact. The second thing that I want to touch on is making sure that we are celebrating our wins, no matter how small you may think, no matter how insignificant it may mean to other people, you deserve to celebrate, right? We as survivors often are given the second chance at life feeling, right? So why not take this time to celebrate and be happy and change the mindset? Maybe it's not being able to have the blow dryer up for the amount of time that it needs to do your hair. That's a small win. That's a great win, not having to have my arm nice and heavy with this blow dryer in my hand. I can hold it up. You know, that's a great win. And then something as big as, you know, having the ability to fully reach over your head. Or maybe you used to be a runner and now you can walk to the mailbox without getting winded. All of these things are small wins that that add up to a big win, right? It's further and further away from that diagnosis and further into survivorship.
I love
The
those
third thing,
suggestions.
yeah, there's plenty of more suggestions too, and it's not just questions that I want people to talk about in the discussion too. If you have some wins that you are proud of, the survivors all love to celebrate everyone's wins. I love celebrating my sisters in arms when they have wins of their own. And that's what I think makes our community so amazing. So remember that, if you don't have a question, maybe you can post up the great thing that you have done or accomplished in the past couple of days, weeks, or months.
I love that. And instead of thinking to yourself, okay, I did my 5 minutes of sprinkling throughout the day and going and grabbing a cookie at the end of the day to celebrate, stand in front of the mirror, look at yourself and say, way to go, girl, you did it.
Mm-hmm. Your body hears everything that you are saying,
Yeah.
and that's thinking, saying, and actually saying. So when we change and flip the script, our body will become more inept to the positive things in life.
Oh, I love that.
The third thing, and this kind of goes along with what we were just saying, is focus on what feels good, right? We've gone through so much pain, so much stress, so much frustration. We want to celebrate the things now, right? So whether it's going for a short walk, maybe you've never tried yoga and you want to try yoga now, go for it. Maybe you just want to break out into a huge dance with your family in your living room. Choose something that's going to make you happy, because if you're happy, it's not going to feel like work. And the last thing that we need is something like movement to feel like a chore, because then you're not going to do it, right?
Mm-hmm.
Now, coinciding with the feeling good, I want everyone to remember to listen to your body. As much as your body is listening to you, conversations are not one-sided. It's a two-way street, right? So you need to also be open to listening to what your body is saying. If you're feeling tired, maybe do some gentle stretches, drink some water. If you're still tired, you're probably tired. That's something that one of my friends, who is a radiation oncology nurse, taught me when I was going through radiation. If you drink your water, have done your movement, and you're still tired, your body's telling you it's tired. So listen to it, right? Movement should ease your body, ease your mind, not add to it. So with that being said, let's go into a nice little movement segment. It's something that I give to a lot of people. It's a nice, gentle upper body stretch you can do at your desk. You can do it on the floor, wherever you are comfortable. It's about 10 different stretches, starting with the neck. So
Did you see me
everyone,
readjust
yeah,
myself?
I saw. I was like, ooh.
I'm ready. I am ready.
We're going to start with some breathing, right? This
Now,
is a,
I have a question. Do we
oop,
want to go to full screen you and I so they see more of you, or do you have
we
more
can do that.
slides to share?
We can definitely do that. Let's do.
Because to me, if they see you more, Rori, then yes, there you are. Let's do it.
Okay, so we're going to start with some breathing exercises, right? Most of us, especially us New Yorkers, hello, we love to breathe through our shoulders, right? Nice, quick breaths. But when we want to get out of that fight or flight mode, we really need to start breathing from our diaphragm, right? You may have heard this term belly breathing before. We don't want to send the air directly down to our tummy because we don't have lungs there, but we want to focus on moving that diaphragm. So what I would have everyone do is we're going to sit up nice and tall, right? So that we have ability to kind of lengthen that spine, bringing that crown up nice and tall. I would have both of your hands on your rib cage, right underneath your foobs, boob, whatever you got. And we're going to focus on inhaling for 4 seconds through the nose and exhaling for 6 seconds out through the mouth.
Do we
So
sometimes call this box breathing?
Yep, it is box breathing. So sometimes they'll do like 4, 4, 4, and 4. So inhale for 4, hold for 4, exhale for 4, hold for 4. So there's different styles. When we're trying to get out of fight or flight, we want to focus on the exhale being longer than the inhale. That will always give that oof feeling that we desperately want, right? So what we're going to do here is bringing those hands on that rib cage. I'm going to coach you through this. So we're going to just take a nice inhale for 4, 3, 2, 1. Exhale, 6, 5, 4, 3, 2, and 1. Inhale again, 4, 3, 2, 1. Exhale, 6, 5, 4, 3, 2, and 1. Good. So notice how when I'm counting, I'm going nice and slow. I tell my clients all the time to slow down, right? We need to slow down. I know we're all in a rush to get better, feeling like we can move easily. But again, the slower you go, the bigger the impact. So now we're going to start with a nice gentle neck stretch. So we're going to bring the left ear to the left shoulder. And while we're doing this, the right arm is going to be straight down by our side. We're going to send that right arm to reach down towards the ground while keeping the left ear to the left shoulder. You're going to feel a nice gentle stretch, maybe on the outside of the neck, depending on where you're looking, maybe the front, the back. And then we're going to bring that head back up to center. We're going to do the same thing on the other side. So we're going to bring that right shoulder to the right ear and send that left arm down to the ground, creating opposing forces. And then we're going to bring that head back up to center. Now from here, we're going to do some rotation. It's very important that when we rotate the head, that the eyes lead the way. If your head is leading the way, you might get a little dizzy. So as we start to look towards our right shoulder, our eyes are just slowly scanning the room until we reach a point that we feel this nice tension, and then coming back over towards the center and over to the left shoulder. And then we're going to go back through to the center, going back over to that right side, again, letting the eyes lead the way. Focusing on that breathing as we come back through to center. Coming over to that left shoulder. Now from here, we're going to do a nice neck circle. So we're going to tilt that chin up towards the ceiling and ever so slowly roll that right ear to the right shoulder. And then bringing that chin down, feeling all of those tiny little muscles that never get any love. Bringing that left ear to the left shoulder and going one more around the body. This is really good to do if you're on a computer all day long, looking up. And then once we get to the left ear to the left shoulder, we're going to reverse that direction. So we're going to come down over to the right shoulder, looking up towards that ceiling. And then going one more full rotation ever so slowly. The faster you go, the less likely those small muscles get any love. And then once we get up towards the ceiling, we're going to bring our head back to center. From here, since we've opened up the neck, we're going to open up some of the shoulders now. So we're going to bring those shoulders up towards our ears, squeeze those shoulder blades to bring them back down, and then roll them up and back a couple more times. Really feeling that shoulder blade in the back start to move around the rib cage. And then we're going to just take a break here. Now, for this next one, if you cannot get into full overhead range with your arms, that's okay. Just go to what feels comfortable for you. So if you have to bend a little bit, that's okay. We're going to work on opening up the sides of our bodies, getting some more lung action, right? So we're going to bring our hands up over our head. We're going to flip our hands up towards the ceiling. We're going to sit up nice and tall. And then we're going to go over to that left-hand side. And as you're here, you're going to take a nice big deep breath in. And then exhale, come back to center. If you need to bring your arms down, you are more than welcome to. Otherwise, keep those hands where they are and go over to the right side.
Feeling that stretch on the waist side, on right at the
Yes.
waist. Yep, I'm feeling it.
And then come on back up to the top. You can release those hands and we're going to go into our next stretch. Now, normally I do this against like a door frame. I call these my door frame stretches because every time you walk through a door frame, I want you to associate putting your arm out. You know, it can be out up top, it could be in a cactus pose, it could be down low, anything to get that range to kind of move that chest a little bit, okay? So I'm going to demonstrate this on the wall over here. So for the first one, we're going to go into a cactus pose. So cactus pose means that our elbow is going to be bent at a 90 degrees. We're going to put our hand either on like our computer chair if you want to turn, a wall if you're near it, and we're just going to put it out gentle enough and then twist towards the opposite direction so that you feel a nice gentle pull, maybe in the pec muscles, maybe a little bit in the armpit or the front of the shoulder, and just breathe into this.
I'm
Work
not doing
on
it
that
because
big.
my wall's too far behind. Gonna do it
You
at
can
the
squeeze
gym
the shoulder
today.
blades. And then we're going to rotate back to center. We're going to do the same thing on the other side. We're going to put that arm out in cactus pose against the wall, door frame. If you're doing it without anything, you can just squeeze that shoulder blade behind you and twist towards that opposite direction. Nice, big, deep breaths. And then slowly bring that arm and that chest back to center. Now, from here, we're going to go into a high stretch. So I'm going to show this without anything. Otherwise, you could do it with the wall again. So instead of being in a cactus frame stretch, you're going to put your arm up straight out over your head. If you cannot come all the way up like this, you can come out into a little bit of a Y. That's fine too. You're going to take your hand out. We're going to twist towards the opposite direction, squeezing that left shoulder blade down into your back pocket. That should engage the pectoral muscles to relax as we contract the back part of our sides. And then we're going to come back to center, bring that arm down, and we're going to do the same thing for the other side. So that right arm comes out. We're going to twist to the left side. Again, if you need to, you can always bring that shoulder blade to that back pocket. Twist till you feel a gentle stretch. Stretching should never cause pain. And then we're going to come back down to center. Good. So I hope everybody's feeling good now. We're going to do some active stretching, right? What we just did is called static stretching. So we were breathing into these movements. Now we're going to activate since it's right now it's 1:45. So we've got a little bit more time to go in the day. So we're going to do some mobility work to wake up that body, but still get some stretching just like you can do while you're working, okay? So the first one that you can do is called thread the needle. Thread the needle can be done on the floor or it can actually be done at your desk. So I'm going to do this as if I were on a desk, okay? I'm going to sit super close to my desk, right? So say I'm typing away, typing away, typing away. I'm going to put my hands on the desk and then I'm going to take my chair and roll it out so that my hands are nice and straight. This is called elevated child's pose. From here, you're going to take the right side. So right hand is going to thread underneath that left side onto the left knee. Then from here, you're going to come unthread it and then twist that right arm up towards the ceiling. And just work with your breath, threading that right arm underneath the left, unthreading it up towards the ceiling. And we should get some mobility in our back with this. A nice chest stretch at the same time. I usually do about 3 to 5, and then I bring that right arm down. You're going to do the same thing with the left arm. So the left arm is going to thread under that right arm, and then unthread up towards the sky. Keep threading that needle. Really reaching for that ceiling. You can look towards your fingers, give yourself some spirit fingers. And then last time doing that little thread and coming back down to center. You're going to release and you can go right back to work. So I hope everybody was feeling good after that little movement segment.
My blood is flowing. I had to unpeel the layers.
Hot flash, hot flash.
All done.
So, oh, sorry. I thought you were going to say something.
Oh, no. I'm just cooling off and getting a sip of water.
So, speaking of hot flashes, the more movement and the more gentle stretching and exercise you do can actually help reduce the intensity and the frequency of hot flashes. So, for those who are experiencing it, that's another little kick to say, I got to get moving, right? But I just want to say thank you for spending this time with me and Terry. Remember that your body is resilient and movement can absolutely be a form of medicine.
You know, I love this, Rori, because I'm not kidding. The gym pants are going on. I got ready because I thought, I know what you're going to do this morning. And I'm headed to the gym after this. I kid you not. But my body feels warmed up. So
Yes.
I guess the one thing, I'm going to scoop my chair back up here. I guess the one thing that I would mention for anyone who would be watching this, like Roy said, listen to your body and don't start any exercise until you are cleared. If you just had surgery, treatment, whatever, talk to your medical profession about that. These were some simple, fabulous, effective exercises that you gave us this morning. I love the presentation with the research that you provided and all the things. So again, tell us real quickly where we can find you.
Yeah. So I'm on Instagram, Facebook, TikTok, YouTube, all under Foobs and Fitness. My website is www.foobsandfitness.com. I've got a lot of resources on there. I have a blog where I do a lot of talking about exercise and movement. I've documented my radiation journey on there too. And then if you need to email me, my email is info@foobsandfitness.com.
And we'll have all of that in the notes on this YouTube video. Thank you, my friend.
Thank you. This is so
Hop,
amazing.
yeah, hop over to her Instagram account for a little love in February. You might see some love sharing with Rori and Terry over there.
Lots of love.
Lots of love. Thank you so much, my friend, for doing this for us today. I appreciate you greatly.
Of course, it is my absolute honor. Thank you so much.
Take care, Rori.